Hello everyone, welcome to my channel. Today's topic is again from Pediatric Nursing for BSc third year. This topic is infant, growth and development of infant. Let's get ahead. We will start from physical growth and development of infant. We have many more other subheadings coming ahead. First of all, physical growth and development. The baby, newborn baby, grows most at infancy than any other age. That means each day, each week, and each month, there is some growth and development in the baby. So, the growth of baby can be recorded in a growth chart. Within a year, there can be a chart where baby's growth and development can be recorded. Also, there is an average growth rate chart with which we can compare our patient or our baby to see that whether they are growing and developing properly as per the average rate or not. We'll start the physical growth from birth weight. Between 4 to 6 months, birth weight doubles. In 12 months, birth weight triples. Growth of length and chest circumference. Length grows about 1 to 1.5 inch each month till 12 months. And the baby becomes 2 times longer than birth by the time of 12 months, that is 1 year. Head grows about 1.5 inch. We can measure its circumference each month for the first 6 months. 1.5 inch each month for the first 6 months. And chest diameter becomes larger than head by the end of 12 months. Diameter, also circumference, become larger than head by the end of 12 months. Regarding teeth, dentition, in 4 to 6 months, there are 2 lower central teeth, whereas in 7 months, upper central teeth, lower and upper both side teeth within 9 to 11 months. That's why if mother is breastfeeding 9 to 11 month child, the child can bite the nipple. Central and lateral incisors are grown within 6 to 8 months and 8 to 11 months. There are total 6 to 11 teeth on an average at the end of first year. After that comes gross motor development. Within 2 months, baby has automatic reflexes that is present since birth, like Moro reflex, grasping reflex, but they slowly start to disappear. Some reflexes are there, like blinking reflex, which do not disappear, but there are some reflexes that developmentally disappears. That means body is developing and body does not need those reflexes anymore. Within 2 to 3 months, baby can lift the head up when child is on stomach. 4 months, child can continue to support his head until neck muscles grow stronger. That means child can hold the neck. Within 4 to 6 months, child can sit with some support, roll over from back to side and abdomen to back. That means roll over 180 degrees. 6 to 8 months, hold the head up. 8 to 10 months, crawl. Now movement has started. Reaching out for objects, reaching out for the thing that child demands begins from 8 to 10 months. Pulling oneself into standing position while holding on to furniture also occurs almost at the end of 10 months. At 10 to 12 months, child starts to cruise, that means travel, walking on while holding to furniture. Fine motor skills are the skills that are performed by using lesser body surface area, whereas gross motor skills were the skills that were performed by using a larger body surface area. Within a month or after a month, the grasping reflex starts to disappear and infant can open the hand. Within 3 months, they can hold a rattle but not reach for it. Hold something but not move the hand to reach up to it. 4 to 6 months, child has developed hand-eye coordination, grabs the object and bring hand close to the mouth, also opens and closes the hand so that he can or she can pick up and look at objects. So by 4 to 6 months, they are able to hold a soft toy that you give to them, a little small size soft toy. 7 months, they can let go of object in hand, that means throwing, letting go, and can move the object from one hand to another hand. 8 to 9 months, they can dominantly use one of the hand, either right or left. 12 months, put an object into container and turn the pages of book. Next, we come to daily living activities. Daily living activities are like sleeping, waking up, having food, feeding. Such activities also develops gradually with age. Like in 2 months, child needs 4 to 5, infant needs 4 to 5 ounces in which is enough during each feeding. 1 ounce contains at least 30 mg or 30 ml. If the mother doesn't want to give 30 mg or ml at once, you can ask the mother to start from 20 ml and then reach up to 30. 3 months, there is a regular schedule of sleeping, eating, and playing of the child. Child begins to sleep 7 to 10 hours at night and remains awake mostly during day. In 4 months, child can have 5 to 6 ounces for each feeding. 6 months, there is a need of solid food now. Exclusive breastfeeding was done till 6 months. After 6 months, the child needs solid food. We call that solid, introducing solid food, weaning food. Weaning food is a powdered form of all the cereals that we consume daily, and we mix it up so that all the nutrients can be covered within it, and we give it to child by making it dilute on a milk or making it softer with the milk or water. 8 to 10 months, the child might nap 2 times a day but sleeps 10 hours during night. Almost 10 hours if the child sleeps during night, there is still 2 naps a day that child requires. This napping, resting is also for growth and development of the body. Next is language development. Child learns whatever the family speaks, whatever language the family speaks, because child hears the language continuously, and first language development is whatever the caregiver or family speaks. By the end of first year, the infant will be able to speak a sentence and also understand the sentence that other person is speaking. Between 0 to 1 month, child tries to get attention of the mother by crying, smiling, laughing, producing a sound, and also using body movements. Within 2 months, they can make vowel sounds. By 4 months, they can make consonant sound. By 6 months, they can produce monosyllable sound. By 7 to 8 months, bisyllable sound. 9 to 12 months, they can understand the meaning of some word, like instructional word, come, go, yes, or no. In psychosocial development, the stages of infant is trust versus mistrust. Here, infant learns how to trust. Infant mostly trusts mother or a primary caregiver. And infant learns how to trust. Mostly, the person who feeds the infant is the person infant trusts the most. That's why primary caregiver is the person that infants trust the most. If there is no establishment of trust at this phase, then potential situation is the child who has become an adult will not be able to trust anyone, and there exists a feeling of insecurity in the child who have not attempted or we have not completed developing trust. Here is an example. Here is an infant who is playing and the caregiver offers some food, and then they ask themselves, can I trust the people? If there is complete trust development, then the child completes this stage, trust versus mistrust. The right side diagram is able to complete the trust versus mistrust stage, whereas left side diagram is for not being able to trust. This is a comparison diagram. Psychosexual development, according to Sigmund Freud, psychoanalytic theory. Infancy is the stage of oral development. That means mouth is the primary source of gratification, satisfying. If child is not able to fulfill oral stage, then the child grows as an adult to become fixated at oral stage, stuck at oral stage. That adult might have excessive drinking habit, excessive chewing or excessive talking habit, because the person as a child, as an infant, was unable to fulfill oral development. Next is intellectual or cognitive development. During infancy, the brain grows faster than any other time. Playing with the baby, reading a story is important for intellectual development of the child, because this way child develops reasoning, develops memorizing, and develops many other cognitive abilities. So, we as a parent or as a caregiver should spend time with the baby, tell the stories to the baby, talk to the baby, help the baby reason things, reason everything. At 2 months, intellectual development, their eyes are coordinated and can better focus on objects. Whatever they want, they can focus on that. At 3 months, they follow the object as you move it in front of them. Also, they are able to recognize familiar things, associating, able to recognize the person they used to see every day, and also able to recognize a familiar sound of a family member, familiar sound of a toy, just a familiar sound. At 4 months, they begin to develop eye coordination. They look at bright colors or bright pictures. At 5 to 6 months, they recognize familiar object, also react to unfamiliar, unfamiliar objects. They learn that objects are permanent. They enjoy game like peekaboo and understand that himself or herself is a different individual than the surrounding. There is a beginning of separation anxiety from 6 months. The infant wants to be only with primary caregiver and doesn't entertain any stranger. During 6 to 7 months, there is again stranger anxiety developed. They are afraid of strangers and they manifest it by crying. They show strong preference to mother or primary caregiver. Between 7 to 8 months, they can recognize their name. If you name the baby something, they can recognize their name and respond to you. According to Jean Piaget, we have stages now. There is sensory motor stage. First stage was sensory motor stage, as we saw in our previous video. There were numerous stages, among which sensory motor stage was first, and then birth to 1 month, 1 to 4 months, 4 to 8 months is division. Birth to 1 month, there is a reflexes like sucking reflex, rooting reflex, moro reflex. 1 to 4 months, there is primary circular reactions, that is coordination of activities and movements. 4 to 8 months, there is secondary circular reaction, shifting cognitive horizon beyond themselves. That means being able to recognize, being able to reason, being able to associate. Between 8 to 12 months, there is coordinating secondary reaction. That means pushing one toy out of the way to get another toy. That means coordinating one movement to complete another movement. So, according to age, we have divided sensory motor stage into reflexes stage, primary circular reaction stage, secondary circular reaction stage, and coordinating secondary reactions stage. In personality and emotional development, the child starts to develop personality right from the infancy stage. We can, as a primary caregiver, we can help them to develop their thoughts, develop their emotion. As a parent, as a caregiver, we should also give the child a feeling of safety by providing them attention every time they need. Baby should be confronted when he demands. Baby should be provided love, provided care, and provided enough attention whenever the baby demands. Next is safety measures for the baby. there are potential harms, risk of harms for infant, for which we need to apply safety measures. That is, perform all the vaccinations on time. Baby should be kept to sleep mostly on the back, even if the baby tries to turn. If you are to change the position onto the back. All the medicine, insecticide, pesticide, cleaning products should be kept away from the reach of the baby. As the baby reaches, the only way baby can explore anything during infancy is by keeping it in the mouth, as it is the oral stage. So keep such things away from the reach of baby. Keep small object away from the baby that might cause choking, because as I said, that is their oral stage. They try to explore everything by keeping it in their mouth. Keep small objects away from the baby. Cut down the baby's food into small size bites. Large size bite might create choking. Baby might be able to swallow. Even if swallowed, food might choke. Keep matches, lighters, all the risky things away from the reach of baby. Child should never be left alone, neither at home, nor on the car, or nor near water. Baby should not be left alone on a high place, somewhere they are at risk of fall, neither on the bed, nor on the table, kitchen slab, not anywhere. While driving, there should be use of safety belts. There are safety belts which are customized for infant, customized for toddler also. Those safety belts can be used for driving, because during the movement, if caregivers imbalance their body movement or imbalance their coordination, then the child nearby can have an accident. Baby should be kept in smoke-free area. Any kind of smoke, cigarette smoke, environmental smoke. Do not hold the baby while drinking hot liquid, because they will try to reach to that object, to that anything that you are eating or drinking. While exposing the baby to sunlight, expose in early morning sunlight till 9 to 10 a.m., that is early morning sunlight, baby should be exposed. Otherwise, baby can be a sufferer of ultraviolet radiation. Any sign of fever, vomiting, refusing to eat is a danger sign, which should be immediately noted, and then the baby should be taken to hospital. Thank you so much. Next topic will be discussed in next video.